Starting with the foundation of everything in fluid and electrolytes, fluid balance. But before we can understand overload, dehydration, or even sodium imbalances, we need to understand what normal looks like and how the body maintains it. Fluid balance simply means that what goes into the body equals what comes out. When intake and output are equal, the body is stable. When they are not equal, problems begin. So let's think of fluid balance like a scale. We'll take that scale, and on one side is intake, on the other side is output. Now, when intake and output are balanced, the scale stays level. That is the perfect makeup for the human body. But if intake exceeds output, fluid starts to build up. That scale goes teeter-totter to one side. This is called fluid volume excess, when we have just too much fluid in the body than what we need. If output, on the other hand, exceeds intake, so the patient is losing too much fluid, then dehydration starts to develop. That scale will tip the other way. This is what we call fluid volume deficit. Now, intake includes anything that adds fluid to the body. So for nurses, obviously we always count oral fluids. That would include water, juices, coffees. But we also need to count IV fluids. That would be fluids that go through the intravenous route into the patient's body. We need to look at how much of their tube feedings are going into their system, as well as any medications that would be going in liquid form. This could be either by oral or even intravenously. And lastly, we don't want to forget any blood transfusions. Output, on the other hand, includes anything that removes fluid from the body. The biggest source of this for nurses is urine output. This might come from what the patient urinates in the toilet, or it might be urine output that you assess from a Foley catheter. You might also want to count liquid stool as output. In addition to liquid stool and urine, you also need to check the patient for vomiting or emesis. You need to check any drainage from wounds, such as through this JP drain or through a suction canister. There's also something called insensible losses. Now let's talk about where fluid lives in the body. Fluid isn't just floating around randomly, it's specifically distributed into compartments. Throughout the body, there are blood vessels. These blood vessels carry red blood cells and oxygen to every leg, arm, toe, finger, and organ. This space is called the intravascular space. This is where plasma is located. The body's cells are located outside of the blood vessels in the intracellular fluid. And then lastly, the fluid that surrounds these cells, this is referred to as interstitial fluid. About 2/3 of the body's fluid lives inside of these cells. This is called intracellular fluid. The cells use active transport mechanisms to move electrolytes in and out of cells to help with fluid balance. The remaining 1/3 of that fluid lives outside of the cells, and this is called extracellular fluid. Extracellular fluid is further divided into the intravascular fluid, which is the plasma in the bloodstream, and then it is also divided into the interstitial fluid, which we've already said surrounds the cells. Red blood cells assist the body with fluid balance by moving water in and out of the red blood cells. Now remember, the cells move electrolytes in and out. Red blood cells move water in and out. So why would we care about fluid balance as nurses? Well, fluid balance matters because blood pressure depends on how much fluid is in the vascular space. And again, that vascular space is those blood vessels. Blood pressure naturally increases when the intravascular fluid increases. And vice versa, the blood pressure will lower when the intravascular fluid starts to decrease. Edema also occurs when fluid shifts into the interstitial space. The fluid buildup, or overload of fluid, gets stuck, and it has a much harder time returning into the cells or the vascular space. And dehydration affects cellular function. This is also another reason why we should care about fluid balance. Cellular function is important because it determines energy production, tissue repair, metabolic balance, and even disease prevention. Understanding these compartments can help you as a nurse predict patient symptoms. Let's do a review question. If the patient's intake is greater than their output, what would develop? Pause and think about this. It's always great to come up with your own answer before looking at your answer choices. Let's take a look at your two answer options. Would this be termed as fluid volume excess, or would we consider it fluid volume deficit? What is your answer? It is fluid volume excess. This is when there is too much fluid compared to what is actually coming out of the patient. Remember, we want intake to equal output to have the best outcomes for the patient. Let's do one more review. Where is most of the body's fluid located? Is it in that extracellular space that's outside of the cells? Or is it on the inside of the cells in the intracellular fluid? Take a couple seconds and think about this. Think back to those drawings that we just reviewed. What do you think is the most fluid located in the body? You're right, it is inside of the cells. Remember, 2/3 of the fluid of the patient's body is located in the intracellular space. Let's summarize what we've learned. Fluid balance means intake equals output. Most of the fluid found in the human body is considered in the intracellular space. The extracellular fluid, this is contained with the vascular space as well as those interstitial spaces. And when intake and output are unequal, these imbalances will start to develop. The foundation of fluid balance is very important, and hopefully, utilizing this information, this will help guide you through everything as we build even further.